Let me ask you something honestly. When was the last time you woke up and felt good? Not just, I got through the night. Not just, I guess I slept okay. I mean, truly rested, clear-headed, energized, like your body was actually ready for the day ahead. Take a second. If your answer is, I can't remember, or it's been a while, I want you to stay with me, because this matters more than you think. What if I told you that the low energy you've been brushing off, the fatigue you've been blaming on stress, age, or just life, might actually be your heart trying to warn you? Not loudly, not dramatically, but quietly, persistently. And here's the problem. Most men never connect the dots. They push through, they adapt, they normalize it, until one day, something bigger forces them to stop. I don't want that for you. I'm Dr. Jocelyn, and over the past 5 years in medicine, I've seen this pattern more times than I can count. Men who ignored the early signals and men who caught them just in time. Today, I want to make sure you're in the second group. If you're new here, welcome. This channel is about real health conversations for men. No judgment, no fluff, just what actually matters. Before we go further, do me a quick favor. Hit the like button so more men can see this, and drop a comment, where are you watching from? I read them, all of them. Now let's talk about what your body might be trying to tell you. Here's the story most men tell themselves. I'm just getting older. I've been working too much. I need more sleep. And listen, those things can be true. But here's where I want you to pause for a moment. What if your energy doesn't come back, even after rest? What if weekends don't fix it? What if it's been slowly declining, month after month, year after year? That's not just tiredness. That's a pattern. And in many men, especially over 40, that pattern is often tied to something deeper, your cardiovascular system. Let me say that again, because it's important. Persistent low energy can be an early sign that your heart and blood vessels are not functioning as efficiently as they should. Now, why would that make you feel tired? Because energy isn't just about sleep. Energy is about oxygen delivery. Every cell in your body relies on oxygen-rich blood to produce energy. Your muscles, your brain, your organs, everything depends on that flow. When your cardiovascular system is healthy, this process is smooth and efficient, but when it's not, that's when things start to change. Subtly at first, you feel slower, heavier, less sharp, not sick, just not yourself. And that's where most men get stuck, because it doesn't feel serious. It just feels normal. But normal doesn't always mean healthy. Let me walk you through what's actually happening inside your body, because once you understand this, everything starts to click. Your blood vessels are lined with something called the endothelium, a thin, delicate layer that controls how your arteries expand and contract. One of its key tools is a molecule called nitric oxide. Think of nitric oxide as your body's natural relaxation signal for blood vessels. It tells them to open up, allowing blood to flow freely. When this system works well, your circulation is efficient. Oxygen gets where it needs to go. You feel energized. But over time, because of things like high blood pressure, elevated blood sugar, poor diet, and lack of movement, the endothelium becomes damaged. Nitric oxide production drops. Your arteries become stiffer, narrower, less responsive, and now your heart has to work harder just to push blood through. Less blood reaches your muscles, less oxygen reaches your brain, and the result? You feel tired, even when you shouldn't. Let me give you a real example. A patient, I'll call him Michael, came to see me at 56. He didn't complain about chest pain. He wasn't short of breath. He just said, I don't feel like I used to. Low energy, brain fog, no motivation. He thought it was aging. We ran some tests. His blood pressure, high. His cholesterol, elevated. His blood sugar, borderline pre-diabetic. His heart wasn't failing, but it was under strain. His fatigue wasn't random. It was a signal. The good news? He caught it early. With targeted changes, his energy came back. Not overnight, but steadily. And that's the key word here, early. Because early is where change is powerful. Now here's where this becomes practical, because there are a handful of everyday habits that quietly drain your energy and stress your heart at the same time. Let's walk through them, and I want you to listen carefully, because one of these might be the missing piece for you. Mistake number 1. Ignoring poor sleep. You think you're just tired, but your body might actually be struggling overnight. Biologically, poor sleep increases cortisol, raises blood pressure, and disrupts blood sugar. Emotionally, it leaves you irritable, foggy, disconnected. Practically, you wake up already behind. And if there's something like sleep apnea where breathing is interrupted, you're not getting real rest at all. Mistake number 2, living in constant stress. Here's something most men underestimate. Chronic stress doesn't just affect your mind, it affects your arteries. It keeps your body in a constant fight or flight state. Blood vessels tighten, heart rate stays elevated, recovery never happens, and over time, that constant pressure wears your system down. Mistake number 3, sedentary lifestyle. This one is huge. When you stop moving, your body adapts in the worst way. Blood vessels become less flexible, circulation slows. Your body literally becomes less efficient at producing energy. Even light, consistent movement can reverse this, but inactivity accelerates the problem. Mistake number 4, poor nutrition. What you eat directly affects your blood vessels. High sugar and processed foods damage the endothelium. Healthy fats, vegetables, and whole foods help repair it. This isn't about dieting, it's about fueling your system properly. Mistake number 5, avoiding checkups. This might be the most dangerous one, because everything we've talked about, you can't always feel it clearly. High blood pressure doesn't hurt. High cholesterol doesn't warn you, but they're working in the background, silently. So what do? Let's make this simple. Step 1, check your blood pressure this week. 2 minutes, that's it. Step 2, ask for basic blood tests. Blood sugar, cholesterol, get the numbers. Step 3, move your body daily. Even 20 to 30 minutes of walking makes a difference. Step 4, improve your sleep environment. Cool room, consistent schedule. Reduce screens before bed. Step 5, clean up your diet gradually. More whole foods, less processed, not perfect, just better. And here's what's powerful. These same steps improve both your heart health and your energy. It's one system, one fix. I want to speak to you directly for a moment. If you've been feeling this way, if your energy hasn't been what it used to be, there is nothing weak about that. And there is nothing too late about you. Your body isn't failing you. It's communicating with you quietly, consistently. And now you understand the message. The men who act on this don't just avoid problems, they regain control. They feel sharper, stronger, more present. They get their mornings back, their focus back, their life back. And that is still available to you, starting today. So here's what I want you to do. Like this video, comment where you're watching from, share this with someone who needs it, and subscribe because we're just getting started. I'm Dr. Jocelyn, and after 5 years in medicine, I can tell you this with confidence. Age is not the end of vitality. Ignoring your body is. Listen to it, act early, and you can change everything. Take care of your heart, and I'll see you in the next video.